আজও আমাদের সমাজে অনেক মুমূর্ষু মানুষ আছেন যারা বিভিন্ন কারণে প্রয়োজনীয় চিকিৎসা পান না, যত্নের অভাবে ভোগেন নীরবে। এই কষ্ট দূর করতেই শান্তিনিকেতন মেডিকেল কলেজ ও হাসপাতালের এক অনন্য মানবিক উদ্যোগ শুশ্রূষা। 100 শয্যার এই বিশেষ ওয়ার্ডে প্রবীণরা পাবেন উন্নত চিকিৎসা, স্নেহ ও যত্ন, সবই সাশ্রয়ী খরচে। কারণ আমরা বিশ্বাস করি চিকিৎসা একটি অধিকার, বিলাসিতা নয়। শুশ্রূষা, যেখানে চিকিৎসার সঙ্গে জড়িয়ে থাকে ভালোবাসা। বিস্তারিত জানতে এখনই যোগাযোগ করুন নিচে দেওয়া নাম্বারে।
Where knowledge speaks directly to the listener. A unique journey into the world of health and healing, simplified just for you, where your well-being is our mission.
Because behind every good doctor is a great classroom. Chikitsa Pathshala. Learning medicine anytime, anywhere. So, the future of medical learning is here. In the journey of healing, every heartbeat of knowledge counts. Welcome to Chikitsa Pathshala, where future doctors take their first steps.
So tune into Chikitsa Pathshala. So don't miss it. Positive Varta. Think positive, be positive, positive Varta.
আপনারা দেখছেন পজিটিভ বার্তা প্ল্যাটফর্ম। থিংক পজিটিভ, বি পজিটিভ।
So we are going to the gross anatomy of this neck and the face region. We are going to learn today or subsequent sessions on the development of the neck and the face region. Now, besides the development, which normally do not comes as a question comes as a development error. Like we do not ask you talk about like how the heart develops. Rather we ask you to say that why this ventricle septum is not formed and what goes wrong, or why the atrial septum is not formed. Similar to this, we have this particular neck region have a number of embryological defects. So we have to identify this defect is this, giving some kind of pictures or something like that, and we have to identify the name of the defect and what actually causes that. And later on, as you progress through the life in higher meds, you will be learning how to solve the problem what this particular individual might have. So there are a number of clinical problems which are present in this region, like we call them as DiGeorge syndrome, we call them as branchial fistula, branchial cyst, pharyngeal pouch complex, or thyroid abnormality, parathyroid gland error, like thyroid gland problems, fistula, thyroglossal duct cyst. These are the clinical problems that are going to come to you as like questions. But to understand that, we have to know what this particular thing is coming from and where exactly we will be explaining that thing which will be yielding this particular disease, and what is the remedy if required for that time. Now we are going to learn this particular neck region and the face region, the development of it. So we have number of classes because it's elaborate. It's going to take time. Several weeks we will be spending time on it. Now the basic thing about this particular neck development is really complex, really means very complex. Just like we have the heart develops, just like this particular gut develops, this is also a series or sequel of the things which happens. But the good thing about the neck development is that if you get this particular initial basics done, then it is easy to understand rest of these things. So if you do not understand this today's class, rest of the class will be like all Hebrews and everything else, which you cannot comprehend well, or it will be waste of time. So I'll be going slow in this class because this is a foundation, and with this foundation, we'll be progressing to the development. If you understand this today's class basic well, then we can understand the problems which is coming to you as a clinical problem, as a clinical questions. And this particular developmental error of the neck and the face comes frequently for us. Reason why? Now, if you have a heart problem, we cannot see. The patient cannot see. If you have a face disfigurement, if you have something bulging out in the neck, it is visible. So that draws attention and patient becomes conscious. As a result of that, this neck face disfigurement or kind of errors is early noticed. That's why it comes more commonly in clinic. That's why you are going to see the clinical cases in the neck error, face error more frequently than that of heart error. The heart problems like a cardiac vascular septal defect or ASD, you have to just like a diagnose it with your skill. But this one, patient will be giving you the diagnosis. I have this problem. So find my solution to you, like that. So for that reason, this particular class matters to us. Now this particular neck and the face region develops from a system, we call them as pharyngeal apparatus. So we have these things to cover, and these things covers this neck, face and everything which is going to happen in developmental part of the neck and face region. So anything and everything in the neck and the face region is related to this pharyngeal apparatus. Now as you understand, apparatus is an instrument, it has sub-components. So this apparatus means it has some subgroups or subdivisions as well, which we are going to pick one at a time and understand that. But for today, we are just focused to talk about what is pharyngeal apparatus and what are the components and how these particular components yields into different parts of the neck and the face structures. So this is what we are going to talk about, the developmental basis and anomalies of the neck, face and these regions. So when we are going for the process of development in utero, in embryo, we didn't have any neck. We had the bulging brain coming out, forebrain, which was going on for the neural development. We have this heart going on the pericardial development. We have the gut tube, which is formed by the yolk sac, transformed into tube, getting in. We have the arms developing as projections like limbards growing and slowly progressing. But unfortunately, we didn't have any neck, but we had to create one. So the component which creates our neck and the face region, we call them as pharyngeal apparatus. So the thing which comes here. So we have to develop the neck region from some components. That particular component or machinery we are going to call as pharyngeal apparatus and pharyngeal apparatus components. So this particular neck development happens around the part of this developing embryo, which you see that this region is a brain region. This bulge we see here is a heart region. And we have a very narrow strip of gap tissue present in between. So we literally didn't have any neck. So in between this region, brain, we have a depression under to it. We call them a stomodium. We call them a stomodium is that region which develops our mouth or future mouth. So stomodium is covered by membrane. We call them as buccopharyngeal membrane. If the buccopharyngeal membrane ruptures, our mouth continues with this yolk sac tube. That means we eat the food, gets inside this esophagus and goes down only if the buccopharyngeal membrane ruptures, which is present deep to the stomodium. That means the depression here is going to form our mouth. Deep to that stomodium, we have a membrane which ruptures to create a passage from mouth to the tube. So you see that we have this tube developed from the yolk sac, which call them as foregut tube, midgut tube, hindgut tube. This particular foregut tube, which is separated from this particular depression over here, we call them as stomodium by this membrane. We call them as buccopharyngeal membrane. This ruptures, we create this particular tract so food can travel through the gut tube. So coming back to this particular depression over here, we call them as stomodium. Now then we have this bulge, we have cardiac bulge. So between this stomodium and this cardiac bulge, there appears some kind of swelling or some kind of bulging out. That particular swelling or bulging out which is coming going to create this neck and the face region around this particular stomodium for us. So this side you are seeing, this is right side. The other side bulges will be also there on the left side. So right side bulge and the left side bulge which is created between this developing stomodium and this particular heart which is going to form this particular neck region. That's what we call them as pharyngeal apparatus. So this is how this going on. So this stomodium, after that we didn't had initially anything between them, between the heart and the stomodium. Then it appeared some kind of bulginess over there. So, and this particular bulginess appears as bars. So you have some kind of bars which is appearing over here, which is a component of pharyngeal apparatus. So this is what we are going to talk here today about this particular pharyngeal arches or formations of the pharyngeal arches. So in the neck region we have this particular future neck region which is developing from this thickening of this region or around the stomodium and this pericardial bulge. So this particular mesodermal tissues thickens in this region. This thickened mesodermal tissues forms a bar which bulges out with time. So this bulging of these particular bars of mesodermal tissues, we call them as pharyngeal arch. So this particular pharyngeal arch keeps on growing and coming up. So if you count this particular pharyngeal arch, counting from craniocaudally, you will see that there are 1, 2, 3, 4, 5, 6 bars appears. So these elevations which is coming from this region around the stomodium going down to the pericardial development region, we call them as pharyngeal arch apparatus component. We call them as pharyngeal arch or bulge. Bulge number 1, 2, 3, 4, 5, 6 like that. So it appears with time. So it starts developing around 5 weeks of time, and as we progress to the 8th week of time, from single to develop to 6 of them. So we have swelling battery neck. 8 guys. 8 battery this. So we have the swelling which appears with time craniocaudally, which is around this developing stomodium. We call them as pharyngeal arches. Now this particular arches, as you can see, we are counting them from the head to tail, 1, 2, 3, 4, 5. Now if you have some kind of elevations, between the elevated margin, we have a depression. So that particular depression is also present between this particular elevated areas. We call this as grooves or depressions as cleft. So we have this particular elevations as an arch, 1, 2, 3, 4, 5 like this, and between the elevations we have a depressions like this, 1, 2, 3, 4 like that. So this depression are on 2 sides. One on the outer side or ectodermal side. So this side which you are seeing here, ectodermal side. If you cut this particular thing, split open, you can see that this particular depression is also present on inside as well. So we have an inside and outside depressions present around this particular bulges or arches. So this depression on the outer side, we call them as cleft. 1, 2, 3, 4 like that. And these depressions between these arches on the inner side or endodermal side, we call them as pouch. So we have to understand what do you mean by these arches, what do you mean by these particular pouches, and what do you mean by these particular clefts. So once again, we didn't had anything before. Then it appears some kind of elevations. Those elevations, we call them as arches. Now these arches, one at a time appears. So craniocaudally, it appears with the time progresses with this embryo. So 1, 2, 3, 4, and eventually we see that there are 6 such arches to appear. So 6 of the arches appears, holds a space which is lying in between them. So this spaces which is present in between them are depressions. One such of depression present on the external side, one such depression present on the inner side of this particular developing foregut tube or primitive pharynx. So the inner side depressions, we call them as pouches. And again, craniocaudally, if you count that, there are 4 such depressions are there between them. 1, 2, 3, 4, like this. And outside we have this 1, 2, 3, 4. So why this is 4? It should be 5. Because initially we had these 6 such of arches are there. So between the arches, if you have grooves, it should have 5 clefts and 5 grooves present inside to it. But why this is number 4? Reason is that we develop 1, 2, 3, 4, 6 arches are there. But later on, one such arch disappears. So we have these 6 arches, 1, 2, 3, 4, 5, and the number 5 arch disappears. So that leads to 5 arches present, which develops the neck structure. And as because we have 5 neck structures as an arch, we have 4 depressions on the either side. One's on the ectodermal side and one on endodermal side. So these arches, clefts and pouches together makes this pharyngeal apparatus. So this is a simple questions that is thrown in examination that describe or define pharyngeal apparatus. So for that you have to understand what do you mean by the pharyngeal apparatus and what do you mean by these arches and the clefts. So all together these things, arches, clefts and the pouches together, we call them as pharyngeal apparatus. And all 3 are contributing to the formations of the neck face structures that we have. So together we have these components to contributing together in the neck and the face component structures. So once again we have this particular element which we started with. So we have this particular bars elevated or mesodermal tissues. We call these bulges as arches, and these arches are this cornerstone or the initial stepping stone for the neck development. So we have these elevations of the bulge which is coming from the mesodermal tissues, and this bulginess increases with time. So number 1, 2, 3, 4, if you count them, there will be 6 of them. Now this 6 out of 6, number 5 is rudimentary, small, disappears. Eventually one regresses, one falls out. So remains over there is 5 bulge, which is known as pharyngeal bulges, also known as pharyngeal arches. Now this particular pharyngeal bulges, as it is progressing out, between these particular arches we have some kind of spaces, one on the external side or ectodermal side, one on endodermal side. Extodermal side we have these grooves or depressions, we name it something, and endodermal side we name it something else. So this externally, if we have this particular, between this particular pouch arches, we have this groove, we call them as cleft. Cleft number 1, cleft number 2, cleft number 3, cleft number 4, likewise craniocaudally. And again, in the mouth side or inside or pharynx side, we have the same depressions present. This is, we call them as pouches. Pouch number 1, 2, 3, 4. And altogether this pouch, cleft and these mesodermal bars, we call them as pharyngeal apparatus. So are we clear with this? What do you mean by this pharyngeal arch, pharyngeal cleft and pharyngeal pharyngeal pouches, and as well as the pharyngeal apparatus? So each of them we'll see with time transforms into future neck structures, which we are going to learn slowly. So this is basic cornerstone. Now we take this arch at a time or at this time and discuss about this particular arches. And later on, once we are done with the arches, we'll go into this cleft, we'll go to the pouch, and we'll see how these transformations happens and what actually yields on it. So we take this particular pouch, out here. So this pouch, the middle portions of it, you see there, this is mesodermal. This is outer side is ectodermal, and this is yellow side, inner side endodermal. That means it has three components present of all the tissues that we have. So we have these three different types of tissue: ectoderm, mesoderm, endoderm. So we have all these things are lining over each of these particular arches. Outside, this is red line that we are seeing here is the ectodermal side. This one is orange, which is mesoderm, origin or mesodermal tissues. Inner side, we have this yellow tissues, which is lining here, is endodermal in nature. So we have these three tissues there. Now out of these three tissues out here, this mesoderm is a kind of special in case of this particular pharyngeal arches. We learn this mesoderm is coming from this particular, coming from the somites or in the mesodermal or intraembryonic mesoderm tissues. But in case of this particular regions, we have a special element comes inside this particular midline region and transforms into the mesodermal tissues. We have a special kind of cells, we call them as NCC, neural crest cell. Now what is a neural crest cell? It's a kind of modified ectodermal cells which is going to form the neural tissues or the brain tissues. So these particular neural tissues are coming from the developing neural tube and migrate like this. This red dots that you are seeing here, this is a kind of like a representations of these neural crest cells. So the neural crest cells is present around this particular developing neural tube, that means neural tissues, and it kind of some cells which detach themselves from the neural tissues and slowly migrate. And these migratory tissues migrates to different parts of the bodies. So this kind of neural tissues, migratory cells, which call them as neural crest cells, during 4th week of life, they migrate from the developing neural tube and slowly move into these developing arches and gets inside. Now once inside within this particular pharyngeal arches, they settle down, they transform and they change. They change from the neural crest cells to modified mesoderms. So they become the ectodermal tissues, switch their characters, become mesoderm tissues. And this mesoderm tissues which is present within this particular pharyngeal arches, they create the skeletal structures in the face and the neck region. I repeat again, because this is the MCQ and this is what we are asking in exam questions. So far we have learned about the bones and the cartilage are developing from the mesodermal tissues. We learned that so far. But in case of this particular neck region, we have this particular facial skeleton, we have the skull skeleton, we have the skeleton in the neck in terms of this particular voice box that we have. Those are the skeletal tissues or skeletal element that we have in the neck region, face region, are coming from the mesodermal tissues. That's for true. But these mesodermal tissues which are present in this region are coming from elsewhere. They are coming from this migratory neural crest cells. The neural crest cells is present or destined to be present somewhere else. They are present around this particular neural tube developing regions. They start and lose free from this region. They move on different directions. And this particular migratory neural crest cells move into this developing arch, settle down there. Once they settle down there, they change their character from this ectodermal neural crest cell into the mesoderm tissues. This mesoderm tissues creates the facial skeleton. You name this bone that face has, you name this skeleton that this skull has, those skull and element which is coming in here is derived of NCC or neural crest cell derivative. This is MCQ that is commonly been given in examinations. That's like this neural tissue, they give any damn name of this particular skeleton. This like maxilla or mandible is cells sourced from mesodermal tissue, neural crest cell tissues, ectodermal tissues, pick the right choices like that. So this is The facial skeleton that we have is primitive source of this is neural crest cells. Now this neural crest cells is a different entity or a big entity. If you talk about that, will cover this neural crest cells. We are not going to talk about the neural crest cells. Our essence of these things is understand this. All the skeletal element that we are going to talk in future is coming from NCC or neural crest cell. That's what you must be able to understand and comprehend. And you given in the exam about the questions about the sources of the skeletal element where from this particular bone is formed of, you should be able to recall that it is coming from the NCC or neural crest cell. And this is different from mesodermal cells because it's kind of like neural crest cells is a neural cell which becomes mesodermal cells, which later on gives the bones in the face region. But again, coming from this region, going to this particular old thing, pharyngeal arch, pharyngeal cleft and the pharyngeal pouches, that's what you should be understanding. And this is how this particular thing should be looking like. This is a developing embryo, that's what you're seeing in this scanning electron microscope, and this is the bulginess which you're seeing here starting to appear with the pharyngeal arches, and in between the arches we have this gap there, we call them as cleft, inner side we call them as grooves, etc., or pouches which is on the endodermal side. And this is the circular thing that we are seeing here is a developing limb bird. This is where this upper limb is going to pop up as a bird, or just like fin, or kind of like a projections which becomes the upper limb. Eventually the lower limb birds will be coming up and will be developing the limbs from here. And this is the cardiac shadow. This is what you are seeing there. This is narrow region. This is what the stomodium is, and gradually these things are stretched because of the development of these mesodermal bars. This mesodermal bar, we called it thousands of the times as pharyngeal arches, and in between the arches we have these grooves, clefts, etc., which is developing into the neck region. Slowly we have this neck develop between this particular space, and as we are progressing, we are developing it. So this starts developing around this age like 4th week, finished by the age of 5th week. So between this 1 week of time, we have no like a pharyngeal bars, and we have 5 pharyngeal bars by the end of the 5th week. And this particular bar eventually becomes this particular neck region. So this is an advanced 6 weeks embryo, which you can see like little bit progressed, like this particular pharyngeal arches and bulges there. This is what we are going to discuss slowly subsequently. And you can see that this is a limb bar which is gradually develops over here. This side already much more developed on these regions. So this is the cardiac shadows that is developing in here. So coming back to this particular pharyngeal arch, which is a component of pharyngeal apparatus. Pharyngeal arches are these particular bars, mesodermal bars, which is developing around this particular stomodium or future mouth region, around this particular future pharynx region, are 6 in number to start with. Craniocaudally, we are counting them, and this number 5 is small, falls out, drops off, and then we have 5 pharyngeal arch to develop the neck region. And in between this particular pharyngeal arch, if you seek through what are the different types of tissues that are present in here, we have 3 tissues are there. We have this mesoderm inside the core of it. Outside we have the ectoderm. Inside we have this endoderm. We have the pictures like this. So this is how it looks like. The arch, if you just like make a section midline, it's mesoderm. Inner side we have this endoderm, that means gut tube side. Outer side we have this ectoderm side, which is lined by these ectodermal tissues which is present in here, and the middle we have the mesoderm. Now this now the tricky thing about this mesoderm out here, this mesoderm of this region is developed from invaginations of this special cell. We call them as neural crest cells. So out of this, you cannot forget about what do you mean by these pharyngeal arches. What are the components which is going to contribute together apart from this pharyngeal arch, like cleft and the pouches, which becomes this particular pharyngeal apparatus. how this particular mesoderm coming in here from the neural crest cells and transforming into different types of things which is present in here and forming these different parts of the bodies. So this is what we are talking about, the mesoderm here. So mesoderm tissues which are existing into this particular pharyngeal arches. So this mesoderm is contributed from this primitive mesoderm, which is intraembryonic mesoderm, which is present in here, and the second infarctions or second load of this mesoderm is coming from the neural crest cells. So this mesoderm within this particular pharyngeal arches are coming from two different sources. One special source is this particular region is the neural crest cells. Whatever these neural crest cells are there in this particular pharyngeal arches, this neural crest cells transforms into skeletal or connective tissues. That means whatever these bones or the cartilages or these ligaments that we had in this face and the neck region, that is destined from these neural crest cells. And whatever the muscles we have in the face and the neck region, that comes from the intraembryonic mesoderms. So the muscles in here within this is coming from the mesoderm. The skeletal element, which should be also coming from mesoderm, but it is mesoderm coming from a transformed variety of the neural crest cells. That means that all the bones and the cartilages in the face and the neck region is coming from the mesoderm, which is transformed variety of this neural crest cells. So each of these pharyngeal arches, 5 of them, all this particular skeletal element is produced from it, is going to have this same architecture. Now, what forms from this particular neural crest, what forms from this all these pharyngeal arches and the pouches? So these pharyngeal arches that we have, that means the tissue that we have. Inside to it, we have the mesoderm. Mesoderm has 2 parts of it. One part of it is this going to form the muscles in the face and the neck region, and some part of it is going to form the bones and cartilage plus connective tissue, that means the ligaments. Now if you have the muscles there, we have to have a blood supply to these muscles. And if we have a muscle there, we must have a nerve supply to it. So each of these particular pharyngeal arches owns have a separate nerve to supply the muscles which is deriving of it. It has its own arterial supply to feed the structures which is developing from it. So we call this as pharyngeal arch nerve and pharyngeal arch arteries. So I repeat again. So we have 5 arches there. So we have 5 pharyngeal nerve and we have 5 pharyngeal arteries which are feeding this vascular and as well as neural contributions to the muscles and the soft tissue structures. Now if we have number 1 pharyngeal arch, number 2 pharyngeal arch, number 3, 4 like this, we have a separate nerve serving this and serving them. We have a separate artery serving them. They are not shared. Am I clear? So this is similar, just like bronchovascular markings. We have a bronchovascular markings which is supplied by this pulmonary artery, vessels, etc., etc. Similar thing happens here. So we have the pharyngeal arch which has the mesoderm. The mesoderm transforms into muscles. Whatever the muscles, the pharyngeal arch number 1 will produce, will make, that will be supplied by this pharyngeal nerve number 1. So nothing else. So whatever the muscles are there, this particular muscles will be getting these branches from this particular pharyngeal arch arteries of number 1. Am I clear or not? So we have these pharyngeal arches and we have this particular pharyngeal arches mesoderm element, and this particular mesoderm element has to grow into muscles in the face and the neck region. So this particular region, each of them are fitted with this component. We have a dedicated vascular supply for each arches separate. We had a dedicated nerve supply this leg. So if you zoom these things, it looks like that. We have this particular cartilage tissue developed from this mesoderm. We have this particular muscles which is growing from these pharyngeal arches. And it is supplied by the artery. We call them as arch artery. Now if it is number 1, we call them as first pharyngeal arch artery. If it is number 2, we call them as second pharyngeal arch artery. Similar thing with the nerve. We call them as the nerve which is supplying to it. We call them as pharyngeal arch nerve number 1 or number 2, number 3 likewise. Clear or not? Because based on this, we'll be progressing further. Then the logic comes, then helps this understanding of this helps us to identify the muscles and the nerve supply, becomes easy to memorize during examination or during rest of the life. Okay, so once again I'm breaking down whatever things we have mentioned. We'll be stopping at this particular point. We're not going any farther from here. So we have this arch, we have learned, we are taking this bulgosal arch which has 3 components, endoderm, mesoderm and ectoderm. We are focusing on the mesoderm. The mesoderm out here is sourced from through 2 things. Intraembryonic mesoderm which is present in the part. Later on it is crowded by further invaginations or influx of several kind of cells. We call them as neural crest cells. Now neural crest cells are no more neural in reaching in these regions. They transform into mesodermal cells. But the neural crest cells which is transforming into mesodermal cells are going to form this particular bones and cartilages only, nothing else. And whatever the resident intra-embryonic mesoderm tissues that we had, that is going to form the muscles on here. Now, each of these arch are supplied by a separate dedicated nerve. Each of this arch is supplied by a separate dedicated vascular supply. That means arch number 1, 2, 3, 4, 5. Each of them are having arch number 1 artery, arch number 2 artery, 3, 4, 5, and so is likewise the nerve. Clear? So, from the arch number 1, whatever the muscles are produced, they are going to be supplied by this pharyngeal arch number nerve which is present in it. I give you an example that will clear us what I am stating here. So we are taking this pharyngeal arch number 1. I am stating whatever the muscle they are coming. So from the arch number 1, it produces a muscle. We call them as muscles of mastication. So arch number 1. The muscles, whatever is coming from the arch number 1, we call them as muscles of mastication. That means whatever we are chewing, these muscles are producing the actions to it. Now we know these names of the muscle of mastication: masseter, temporalis, pterygoids, medial and lateral, likewise. Clear? Now all these muscles, whatever it is, has to be supplied by branches of same nerve, which has to be cranial nerve number V5. That means this particular pharyngeal arch number 1 receives this particular nerve supply from CN5, and this cranial nerve 5 supplies all the muscles of mastications. That's the logic, nothing else. Clear or not? I give you another example. Pharyngeal arch number 2 produces all the muscles of facial expression. I repeat, pharyngeal arch number 2 produces all the muscles of facial expression, and this pharyngeal arch number 2 is supplied by the cranial nerve number 7. That's why all the muscle of facial expression are supplied by cranial nerve number 7. Having despite that, they are sitting on the same face region. So in the same face region, there are existence of the muscle of mastication and the muscle of facial expression. But some are supplied by the cranial nerve number 5 and some are by 7. And why this discrepancy? In case of the upper limb, you see that front side is supplied by some nerve, back side is supplied by some different nerve. But here the logic is different. The logic is the source is supplied from it, and whatever the muscle is coming from that particular source, they are supplied or innervated by the nerve which is resting or lying on it. So this is the logic that happens to appear in all the muscles of the neck and the face region. As we progress through, we'll see that. This is what we have to understand this phenomenon. We call them as pharyngeal arch, pharyngeal apparatus, and pharyngeal arch, which is known as pharyngeal arch artery and pharyngeal arch nerve. Likewise, I mentioned this blood vessel. So whatever these particular muscles are there, these particular muscles will be receiving the motor arterial branch from the artery, which is pharyngeal arch number 1. Likewise, the facial, which is the facial artery, which is supplying that. So all these things are because of these particular orientations of this. The arch, whichever it is, going to produce the muscles, which is going to be innervated by this particular nerve, and the arterial branches will be feeding it. So this is what we call this as the pharyngeal arch phenomenon. So this is what we just mentioned here. Muscles of first pharyngeal arch, all the muscles of mastication, temporalis, masseter, pterygoids, medial and lateral, all of them. Along with that, we have addition to it. We have this mylohyoid, anterior belly of digastric, tensor tympani, tensor palatini. They are sourced from the same thing, first pharyngeal arch, and they are supplied by which cranial nerve? Number 5. That means trigeminal. So branches of trigeminal will be supplying them. If you see this particular branch, we call them as anterior belly of digastric. You'll say another belly, we call them as posterior belly of digastric. The source of posterior belly of digastric is different, and so is supplied by different nerve. So having this particular same muscle, two bellies are supplied by two different nerves because they are originating from different sources. So if you do not understand this particular origin and this particular rationale, how this is supplied with and how they are supplied, that we cannot find or you cannot memorize. So whatever this particular neck region you are memorizing, we are starting with this particular branchial arches or pharyngeal arches, sources of it, and how these things are coming up. The muscle, the nerve supply, the actions, everything falls on this regions. So next day onwards, we'll be talking about each of these particular pharyngeal arches, like skeletal element, which we just like didn't want to talk, bones, cartilages, ligaments. We'll talk about these particular muscles which are coming on and the nerve supply which are supplying to it, and eventually grow into from the arches to pouches and the clefts. So this is the basic foundation. If you do not understand this basic foundation, the neck will be difficult to comprehend, neck will be difficult to understand, because there's really vast, really overwhelming content up there. So consent is that you go for the concept of it and you memorize it, or else it will be difficult for memorizing it. So if you will see that face region, will pick up one muscle like masseter and we will ask about nerve supply to it. If you do not remember this is a muscle of mastication, you cannot remember this nerve supply to it. It is by fifth cranial nerve or branches of fifth cranial nerve. You will say that, oh, face region close to this region, face to ki hobe, or facial nerve bhi hobe. So this will come as a common instinctive thing, and that's what we land up into wrong answers. So again, you have to understand this particular basic thing, pharyngeal components. So we have three things to discuss about. Pharyngeal arch, what do you mean by the pharyngeal arch? What is pharyngeal cleft? What is pharyngeal pouch? And together we call them as apparatus. Arches, each of these particular arches have the mesoderm core inside, ectoderm and endoderm outside. And this particular regions, we have this mesoderm, have got two sources, we learned about that. And the muscles and these elements which are present in it supplied by these particular destined nerves and the arteries which are supplying this particular, each of these particular arteries. First pharyngeal arch is different of that second pharyngeal arch, so is third, fourth and sixth, so on, so on. So this is the basic thing we will talk about later about further development of it. So we will build on next class from here where we have left on. Thank you.
দেখা হবে একটু পরেই ছোট্ট একটা বিরতির পর।